Hello, and welcome to the Life Changing Moments podcast. This is the third episode in our four-part series where we've been exploring the inspiring journeys of chief wellness officers from leading healthcare systems. In our previous episodes, we had the privilege of hearing from Dr. Mila Felder of Advocate Health and Dr. Christina Bowen of ECU Health. Both shared their unwavering commitment to fostering a supportive environment and enhancing the well-being of healthcare professionals. If you haven't had the chance to listen to those episodes yet and could use a dose of positivity about the state of healthcare today, I highly recommend giving them a listen. Today, we're excited to continue this journey with Dr. Christine Hein. Her story is not just one of professional dedication, but also deeply personal resilience. She's experienced firsthand the profound impact of a supportive community within healthcare, a gift that has shaped her path and passion for peer support of her fellow physicians. Her journey from receiving this support to becoming a pivotal figure in promoting it within her institution offers a powerful narrative on the importance of well-being in the medical field. There are times in our lives that change the way we see the world. Navigating these challenges can take insight, trusted confidants, or even a coach. Let's explore those moments. In this companion podcast to RX for Success, we will discover ways to learn and write our own success stories together. I'm Dr. Dale Waxman, a physician coach with MD Coaches, and this is Life Changing Moments. By way of introduction, Dr. Christine Hein serves as the Chief Wellness Officer for both Maine Medical Center and the MaineHealth Medical Group. With a deep-rooted passion for emergency medicine, Dr. Hein has shown unwavering dedication to patient care, held the administrative role of Associate Medical Director for the Department of Emergency Medicine there, and is a nationally recognized teacher in this specialty. As before, because this series has a bent toward well-being, I am sharing what these guests do to keep well. Well, Christina loves distance running, walking in the woods with her two dogs, alpine skiing, reading, and travel. She's married, has 4 daughters and 1 son, and the aforementioned 2 dogs. So, Dr. Christine Hein, welcome to the Life Changing Moments podcast.
Thank you very much. I'm really excited to be here and talk to you today.
It's great to have you with us. I would like to begin by just reminding listeners that we are doing a series with Chief Wellbeing Officers, and actually your name was given to me by another guest that we most recently had, Dr. Mila Felder, and she says, you've got to talk to Christine. And so I'm really glad to have you with us. So just to kind of get us started, give us a little bit of, where are you right now? A little bit of background about how you got there and what your roles are and what you're doing.
Absolutely. Well, I am talking to you from the lovely state of Maine. I'm about 15 minutes north of Portland, and I am the Chief Wellness Officer for the MaineHealth Medical Group and also Maine Medical Center. And I am also a practicing emergency physician, which I've been doing for 24 years now, which is difficult to believe, but time passes. I came to this work because approximately 12 years ago, we had a medical staff initiative where our med staff president really was starting to recognize that there was a need in medicine to support one another. And they decided to start with a peer support program. And so I became a member of a very small subcommittee of the medical staff looking at how to develop and design a peer support program that we could use for our medical staff and house staff. That was the humble beginnings of our program and remains one of probably the most important aspects of the work that I personally get to do every week is actually connecting with and supporting others across our medical group.
Before we get to why you got asked to that, some of our listeners may not know what a peer support program looks like. Can you say a little bit more about that?
Yeah, peer support is a model that's been used in lots of different communities. The recovery community uses it, and it's really a model of one-on-one peers supporting others who have shared experiences. And so when we sort of took this into the healthcare space, it was a model where people with shared and similar experiences, and therefore an understanding of the impact of those experiences, could support colleagues who are going through difficult events or maybe just challenges. And those can be professional challenges, personal challenges, a whole myriad of things that we support folks for.
And for you, that was a entry to the work that you're now doing as a chief wellness officer.
Yeah, absolutely.
Which is more than peer support, I'm sure.
Yes, it is. It was, I would say, the tip of the iceberg. You have to start somewhere. And that's one of the difficult things about this work in well-being is, where do you start? And we started with peer support and then very quickly realized that there was a whole host of things we could be doing that were maybe not as visible as people needing support, but would help with that. And so there's a really interesting way to think about physician distress and the fact that it's a systemic problem that's manifested in individual behaviors. So if you see somebody who's having difficulty with professionalism or seems to be struggling, it's really easy to say, oh, that must be that individual's problem. But in healthcare specifically, there are so many systemic factors that contribute to the individual distress that becomes burnout if it's not addressed.
I just want to say what you just said articulated beautifully some things that I am actually seeing as a coach. One of the types of coaching I do is for professionalism issues, remediation, and almost always, I'm going to say like 9 out of 10 times, it's actually systemic issues that led to the professionalism challenges for this individual. It wasn't this individual waking up and saying, I think I'm going to behave badly today at work. Right. So thank you for pointing that out.
Yeah. Yeah. It's funny that you say 9 out of 10, because when we developed our program, we worked with Dr. Joe Shapiro, who's an otolaryngologist in Boston, and she had the exact same statistics from her experience in peer support, was that it's about 90% of the time, it's a systemic problem manifesting in individuals' behaviors. Brian Sexton from Duke has this really great definition of burnout, where it's the inability to experience positive emotions in the workplace. So you can imagine, if you can't experience positive emotions in the workplace, what kind of emotions are precipitated and expressed, right? So I like taking it back like that a little bit to kind of understand what's in front of us.
I want to go back up a little bit. So there's a reason that people identified you as a participant to create this peer support program. And you have your own story that kind of led you into this work. And I wonder if you'd be willing to share that with our listeners.
Yes, absolutely, I would. I would say, the fortunate recipient of peer support before we even had a peer support program at Maine Medical Center. As I mentioned, I've been practicing emergency medicine for 24 years, all in the same place. I did my residency and then stayed there as an attending physician. And I built some pretty strong relationships with my colleagues, most of whom are still practicing alongside us today. And I unfortunately had an event in my life that was a rather precipitous, unexpected, unanticipated event, where my husband at the time had a addiction that I was unaware of and completely blindsided by. He told me he was going to a job interview, but actually he was turning himself in to be arrested for this addiction to pornography that he had. And I didn't find out until he didn't come home from his job interview. So it was about 24 hours after he left, when he didn't return, that I was unfortunately had to unravel this story. And so I became a single mother to our 3 children overnight. I mean, I was completely shocked and almost unable to function at the time for, a period of 24, 48 hours. I just did not know what to do. And I was filled with shame and guilt for even being in this situation to begin with and not seeing it for what it was. And a lot of fear for my children that they were never going to have a normal life or a happy life. So all of that came crashing down on a random Tuesday in May. And without asking for it, my colleagues decided that I should have 6 weeks off with all of my shifts covered. They covered every shift I was scheduled for. I was a full-time emergency physician. That was not a small number of shifts for them to pick up, and gave me this gift of time with my children to kind of put myself together, at least in a way that I could access counseling for our family, figure out what I was going to do to who was going to take care of my young children while I was working, and how I was going to make sure that they had some consistency in their days, understanding that their lives had just been turned upside down. So I cannot emphasize enough what that meant to me. I definitely am filled with gratitude to them for those really kind, compassionate behaviors and the outreach that they all took upon themselves without knowing what was going on. They just knew something catastrophic had happened. And slowly over time, I was able to share with people, but certainly that was not a process that I was even willing to entertain for months, in some cases, years. And I really had to keep my focus on my children and just like the day-to-day of, it was like an hour-to-hour thing of what are we going to do this hour? What are we going to do in the next hour? I think it was encapsulated one day for me very shortly after. It was the same week that this all happened. And I was walking in the woods with my kids and a friend. And she identified that as a question mark day, where you get up, you don't know what you're going to do, and you just do. And you don't have to have the answers. And I was like, wow, they gave me all these question mark days that I really needed. And so, with the support of my family, my parents, and my friends, my community, we got through that. And it's become very important to me to help others who are experiencing challenges, whatever they may be, because there isn't a lot of space in medicine for challenges. We don't build that into our culture, that people are going to have struggles, whether they're related to the actual practice of medicine or whether it's personal struggles that bleed over into your professional life. We haven't historically made any space for that or any safety net.
Are you a doctor struggling to provide the best care for your patients while dealing with financial and caregiving matters out of the scope of your practice? Do you find yourself scrambling to keep up with the latest resources and wish there was an easier way? Then this virtual caregiver conference resource will save you time, money, and sanity by giving you all the resources and information your patients need in one place. This conference helps you and your patients enlist the best strategies around healthcare resources and the best financial steps for your patients while navigating caregiving situations. You don't have to go home feeling frustrated and helpless because you couldn't connect your patients with the best services. Find out more at jeanniedoherty.com or click in the link in the show's notes. You don't want to miss this caregiver resource.
Hi, I'm Rhonda Crow, founder and CEO for MD Coaches. Here on RX for Success, we interview a lot of great medical professionals on how they grew their careers, how they overcame challenges, and how they handle day-to-day work. I really hope you're getting a lot of great information. But if you're looking for an answer to a specific problem, management or administration challenge, or if you're feeling just a bit burnt out, like maybe you chose the wrong career, well, then there's a faster way to get the help you need. No, it's not counseling, it's coaching. RX for Success is produced by MD Coaches, a team of physicians who have been where you are. I know you're used to going it alone, but you don't have to. Get the support you need today. Visit us at mymdcoaches.com to schedule your complimentary consultation. Again, that's mymdcoaches.com, because you're not in this alone.
We'll get back to our interview in just a moment, but right now I want to tell you a little bit about Physician Outlook. If you haven't discovered this remarkable magazine, please do so very soon. It was created by physicians for physicians to showcase the intersection between clinical and non-clinical interests, whether it's writing, painting, cooking, politics, and dozens of other topics. Physician Outlook gives a physician perspective. It's available online and in print. It's really unique among physician lifestyle magazines. And like the Prescription for Success podcast, Physician Outlook amplifies the voice of any physician who has something to say. It also engages patients who still believe in physician-led, team-based care. And Prescription for Success listeners can get 3 months free when you enter our promo code RX for Success and select the monthly option at checkout. That's a really great deal on this stunning publication. And now let's get back to today's interview.
Good to know that you are on this side of that, and you are well on this side of it.
Mm-hmm.
You've done your own work in this area, and then you're also saying that partly because of the support that was offered to you, there's a giving back quality that you're that is driving some of the work that you're doing.
Yeah, absolutely. And I think that in giving back, you have to create some vulnerability in yourself to be able to really do that and connect with people on a meaningful level. And so that's something, this isn't something I share every time I do peer support, but sometimes it's been relevant, and it's been shared a brief version of challenges that I experienced. And I think it's been helpful. I've received feedback that it's been helpful because, as I said, there's a ton of shame that we experience, and also a lot of shame just built into the culture of medicine. And so those things can really compound when you are struggling for whatever reason.
Along those lines, if you talk the word vulnerable, if you are being vulnerable, what does that then make it safer for others to be vulnerable about what they're going through? Is that where you're thinking?
I believe so. And honestly, that was some of the earliest feedback I got. I took these tentative steps with different friends and peers to share this and do so over, honestly, probably the course of a year. It took that long. And when I shared it, I never got the reaction that I kept thinking I was going to get, which was like, oh my gosh, what's wrong with you? Why didn't you see this coming? Yeah, wow, you should be ashamed. There was none of that. It was all, how can I support you and what can I do? And people started opening up to me about challenges they'd had. And one of my friends even said to me, this is a really tragic thing that's just going to make you more relatable to others. And I think, we naturally do that as humans. We kind of make these snap judgments about what we think about someone that we meet and what their life is and kind of how that all presents. And a lot of times we're just missing the mark on that in terms of our assumptions about others. Just
in terms of, before we move on to more things about your role, I just want to, that this show is called Life Changing Moments. That is a very significant life-changing moment.
Yes.
And you've talked about some of the things that you learned along the way and how really important it was for your partners to really give you that space. And also, you just now mentioned, as you began sharing some of the story, the responses that you got from your colleagues were really very supportive. Anything else that the medical community did during that time that was effective for you to allow you to move through that and heal? It was that sense of community. It didn't stop with, okay, we gave you 6 weeks and now you should be all better. It was this longitudinal process of phone calls, emails, check-ins during a shift, people remembering dates and kind of like anniversaries, if you will, of these difficult events. Just the acknowledgement that life isn't a static moment and that will have a ripple effect, I think was really important, because a lot of times when something big or tragic happens, there's this real desire to help in the moment, but then life returns to normal for most people, right? And so how do you support somebody over a prolonged period of time because their life isn't returning to normal? And that,
I think I experienced that again during the pandemic in terms of it's a new normal. Whether you want it or not, it's a new normal and you have to adjust. And there was a lot of people that just continued to listen to me. To this day, we still have conversations. And in many cases, that's developed into kind of a reciprocal process where they'll come to me for help.
Nice. So there's really this bilateral agreement, if you will, that we're safe with each other to talk about some of the challenges in life.
Yep.
You mentioned that the medical culture doesn't really have a space, for this, but it sounds like you're in the process of creating that space. What other aspects of professional well-being, in addition to this peer support that you've developed so well, that you're really passionate about?
If I had to put it in kind of a defined box, I would say bringing joy back to taking care of other people. Whenever I start a kind of a reflective process, when you ask people, why did you go into healthcare? The answers, what they may be kind of varied, but the theme is always the same because I wanted to help. I was motivated to help. And so what is challenging now is that there are so many things pulling us away from that. We have this intrinsic motivation to help others in healthcare, but there are so many aspects of our system that are kind of pulling and eroding at that. So that's however you can do that. And there are many ways, and we can talk about those, but however you can kind of return that joy of helping others. And I know it. I have examples of when it's happened for me, and I feel it in the moment. And I'm like, this is why I do this.
Do you have some stories of others, in addition to yourself, where about the importance of this work of bringing people back to that joy of practice?
Yeah, I mean, I have so many. One of my colleagues and I have this conference that we developed called Saves and Successes that we do for our emergency medicine group. And we just ask our peers to send us good cases that they had these wonderful encounters with patients, a great catch, a good save, or anything that falls under their definition of a save and success. And so we've highlighted at this point hundreds of saves and successes for our colleagues. And the thing about that conference is everybody leaves about 2 inches taller, whether it was their case that was celebrated or their friend's case or someone that they just met, 6 months ago, started residency. It feels good to focus on the positive impact that we're having.
That's such a shift from the morbidity and mortality, right? Which is important. I'm not diminishing the importance of that, but wow, there's a real 180-degree piece there. Let's celebrate things that we've done really well.
Yeah, absolutely. And I have to give my colleague, Dr. Samantha Wood, she had experienced something similar in her residency. And she's like, why don't we do this? So we just said, let's do it. And now we're doing it. And it's really fun.
You've already alluded to these things that kind of pull us away from the reason that we do what we do, that we're going into medicine. What are some of the biggest challenges for you as a chief wellness officer within that right now?
Yeah, it's really the structural barriers to practice. So, I love the Stanford model. It's also the model that the National Academy of Medicine put forth in their recommendations on burnout reduction. But it's like looking at culture of well-being, efficiency of practice, and individual factors as well. And this efficiency of practice remains the really tough nut to crack because that's where all the structural stuff is buried. It's the paperwork, the regulatory burdens, the in-basket management, the inefficiencies of the EHR and the redundancy and workflows. Dr. Christine Sinski has published a ton on this about like the number of clicks it takes to give a flu shot in a clinic, right? And it's like 42 clicks or something insane. And you're just trying to give a flu shot so this person doesn't develop influenza, right? But we collectively, our healthcare system has kind of been just overwhelmed by the massive structural inefficiencies that exist. And so that is a huge challenge to well-being work. And it finds that you're pulled in many different directions when you're doing this work on a daily basis. You might be right at the people level, providing support to people, helping problem solve, and then you're very quickly pulled up to like a system level view of how do we address some of these things? How do we address the administrative burdens that our providers are facing?
Are there any innovations that you see on the horizon or present that might help crack that nut?
Yeah, I mean, it's hard to talk about, the future without noting things like AI and the significant opportunity that exists there. I think we are still in the dinosaur stage of our EHRs. And as I mentioned, all the kind of inefficiencies and the asynchronous work that it takes to just provide care to a human is pretty massive right now. And I have great hope that we're going to see changes in that. Even in the last 5 years, I would say, the literature around well-being has shifted from publications on this is a problem, so identifying the problem, and identifying the cause. So there's a ton of research that went into this, all really important, and less historically research on how do we start to untangle this web. And now we're getting a lot of research on that and some pretty specific recommendations, as I mentioned, looking at like the various domains of, we have to actually start to untangle the web that has been woven.
Well, thank you. That's very helpful. And I want to shift it from systems issues back to individual providers. So I wondered if I'm a healthcare professional and I'm not doing well, and I'm maybe even fitting that definition that Brian Sexton gave, what are some steps that I should take to improve things?
It's a great question. And it's one that I try to emphasize every time I have the opportunity to talk to a group of people, because while we never want to point to individuals as a problem, we kind of started there, right? Like these behaviors are manifestations of a larger systemic issue. We can't tell people to hold on for 5 years until AI has improved some of our workload or our EHRs have been more efficiently developed and implemented. So these individual resources and recognition of the need to seek help is really important. And I would start, if you're just talking about how can like a team start to improve things, you really have to look at behaviors. Are we emphasizing and modeling work-life integration and health and a growth mindset? These things are incredibly important, and we don't ever learn about this in medical school, but like 25% of our burnout is related to our immediate team. So if we can improve our immediate culture in our work environment, you can actually move the needle on your well-being. There's a lot of social contagions in medicine. Burnout and emotional exhaustion are social contagions, but so is well-being if you leverage kind of the field of positive psychology and understand how important strong relationships are for well-being, right? Start there. If you just talking in general, how can we make things better in the very near future? But if you're talking about somebody who's in distress and needs help, then there are resources. We have local resources that we've developed. Some involve coaching, which I'm a big fan of. Others, we've developed access to mental health resources that are available to all of our team members. We've actually contracted with an external group that provides kind of coaching and opportunity for problem solving. And our medical group just pays for that. It covers it. You don't have to report that you're using it. There's no report back on what you're talking about or what you're doing. It is completely confidential and anonymous for people who opt to use that service. There's also national services that are available. A lot of work has been done by the Lorna Breen Foundation, who was the emergency physician who died by suicide early in the pandemic. There's actually a national physician hotline for mental health hotline that's staffed like 8 a.m. until midnight, I think Monday through Friday, by psychiatrists. It's incredible what's out there, but the problem is raising awareness and reducing the stigma that people feel with reaching out for help.
It sounds like you're doing a lot to reduce the stigma, not just by having the programs, but also by telling your story.
Right.
This thing about vulnerability that we talked about is a way of reducing that stigma that we're also humans here.
Yeah, absolutely. Absolutely. And I've been fortunate to work in a system that has really embraced this and said, yeah, we need to attend to this. What can we do? I've really benefited from that. And then with my personal experience and then all the experience that I've had as we've built this program for the last 12 years, it's become something that is incredibly meaningful for me in my non-clinical life.
So you mentioned earlier you're a big fan of coaching, and so I'm curious, how can coaching play a role in improving the well-being of the healthcare professionals and organizations?
Well, I'm going to go back to Brian Sexton on this one. I heard him speak recently, and I was just really impressed with he had this very simple statement about creating more opportunities for a pause in our professional lives. And anytime you can kind of do that, then you're improving our ability to reflect and grow, right? And kind of sit in that growth mindset, if you will. The growth mindset is something that I've read about. I'm definitely a fan of trying to encourage that in myself and in others. And I think, again, goes a little bit against the grain of our traditional medical culture, where we actually think about perceived errors or challenges as an opportunity for growth instead of kind of flogging ourselves endlessly over them. And so I see coaching as this incredible opportunity that allows for all of those things. It's an opportunity to pause. It's an opportunity for professional development. It's an opportunity for self-efficacy. Like, coaching is not telling someone what to do and how to get somewhere, right? Coaching is about letting them identify where they are, where they want to be, and map out how to get there. And so for me, I think that dovetails so nicely with this creating a culture of well-being, where we're encouraging people to pause and see opportunities as a chance for growth, not necessarily as this negative thing that we may characterize it as.
You're really radiant about this work. I mean, you really embrace this wholeheartedly, and there's I'm imagining the colleagues who you work with are really benefiting greatly from just your energy. And I'm just imagining you're walking down the hall and people stop you all the time to tell you their stories about what's going on.
That's very kind of you. I am very motivated by this work. And I have this wonderful program director that I've worked with for 10 years, who's just incredible, Diane Albano. And the two of us, I think, come at this from a place of really, again, wanting to help. So I do feel like a lot of people will stop and talk to me. I have a lot of meetings one-on-one with colleagues and try to figure out how to help them move through whatever it is. I'm also worried about the people that don't. I know that there's so many people who want to reach out but don't for whatever reasons. And so those are the things that kind of motivate me to keep going and to try to highlight over and over and over again, like what we're trying to do, so that people really understand what our mission is in this work and what we're trying to achieve.
Well, it's been really delightful chatting with you and hearing the great energy that you're bringing to your healthcare system, but obviously have an impact nationally because people know about you to, have me know about you as well. Before I let you go, is there anything that I haven't asked you about that you feel that you'd like to make sure that our listeners hear about?
Well, it probably goes back to, why I'm doing this in the first place, which is my ex-husband did not ask for help and was kind of swallowed whole by something. Now, that's an extreme example of something, but I personally understand the wreckage that can happen when people aren't empowered to ask for or seek help. And so I want anyone who's struggling to understand that it can get better. I never saw how there was ever going to be a silver lining to this situation. My first plan was to change our names and move to Hawaii. I thought that might be a good idea, but that, fizzled after a half hour of consideration. And there's always a path forward if you ask for help. For people who aren't struggling, but are just really interested in this topic, there's opportunities to join and be part of the solution. And it's really meaningful work to think about leaving our system in a better place than where it is when you enter it, to encourage people to want to join our healthcare system as a whole. We hear so much negative stuff about it, but I've never regretted for one day wanting to be a physician. It's incredibly meaningful to me. I'm worried that if we're losing our biggest resource, which is our people who are leaving or not entering the profession, that we've got to do something about it.
Yeah, very wise words. And thank you. You are, along with us, actually, at MD Coaches, we are also in that same group of people that care a lot about our profession and want it to go forward. So thank you. Thank you for enhancing this podcast. Thank you for being a guest here. I really appreciate your perspective and your wisdom. So Dr. Christine Hein, thank you so much for being a guest on Life Changing Moments.
Thank you, Dale. Very much appreciated it.
I'd like to thank Dr. Christine Hein once again for being a guest on Life Changing Moments. Her story truly redefines the concept of paying it forward. I was especially impressed by how her partner stepped up to support her, not just during the immediate crisis, but also in the weeks, months, and years that followed. This pebble in the pond, if you will, has rippled out, leading Christine to spearhead efforts for more widespread emotional support for physicians, a sorely needed resource that has been way underutilized. I also would like to extend an invitation to you to leave a message. Perhaps you'd like to share a story of your own about being supported by a peer or discuss anything related to professional well-being. You can leave your message via our SpeakPipe link in the podcast show notes. Your contribution may be featured in a future episode of Life Changing Moments. Tune in 2 weeks from now for the 4th installment in our Chief Wellbeing Officer series, where I'll be interviewing Dr. Gaurav Agarwal from Northwestern Medicine. Until then, be well. Thank you for tuning in to Life Changing Moments. If you enjoyed this episode, please be sure to rate us 5 stars and leave a review. Doing so helps our podcast reach more listeners. Have something to share? We'd love to hear your thoughts. Visit the MD Coaches community on Facebook groups. This dynamic virtual space is a place to continue discussion about life-changing moments and perhaps share some life-changing moments of your own. Join the conversation today.